Hi, my dear friends. So, the next common question and the errors which we come across amongst the diabetic patients are those who are on insulin, whether they are taking the insulin properly, in a proper place. What we call this as insulin technique, insulin site shifting, and insulin site examination periodically. Not just the patient, but the patient's well-wishers also have to examine the site, observe the site for any rash, for any change of color, that is discoloration, like this. We haven't seen any big problems in those patients who take the insulin correctly. Yes, we have seen very few cases where there had been few problems like infection on the site of insulin. That's because the insulin was contaminated and it was not properly used. That was one of the reasons, and that we have seen only in 1 or 2 patients amongst a very huge number. Next, the other problem which we have come across is patient taking the insulin on the same site. This gives some troubles to the skin. The insulin is not absorbed properly when taken on the same site again and again. So site rotation is very, very important, not just on the thighs or on the arms. Insulin can be beautifully taken on the abdomen, leaving 1 inch around the umbilicus, and it's very easy to manage and rotate the site. So the more you keep rotating the site, the less often you may come across any skin irritation or malabsorption of the insulin from the site of insulin. If a patient is taking long-acting insulin and short-acting insulin, it's better to take the long-acting insulin on one half of the abdomen and the other insulin on the second half of the abdomen. So this also again need to be discussed with the physician assistant or the doctor. And now we also have the we also have the GLP-1 analogs, which are also available in injected forms. So not to take the insulin and these GLP-1 analogs on the same site or very close by. It's better to change or have a distance between these 2 injections for those patients who are taking them. And for those patients who are on insulin pumps, again it's very important and very, very important for the site rotation, as the sticker, the insulin delivery point is there continuously for 3 days or 4 days. So it's very important to take the next site for the insulin delivery device at least 2 inches. So better to maintain 2 to 3 inches of gap from one side to the other. Next, the insulin shouldn't be mismatched with their concentrations. We have seen some problems in patients who are using the IU100 strength that should be taken with the IU100 syringe only. But in some cases, and it happened due to the misguidance of the pharmacist actually, the IU100 strength insulin they had taken with IU40 syringe. When you do like this, the insulin dose is 2.5 times more taken, which leads to definitely hypoglycemia. Say a person needs to take 40 units in a IU100 syringe, the IU100 insulin. If he takes with the IU40 syringe, he is injecting 100 units. So a person who is supposed to take 40 units, and if he is taking 100 units, definitely he is going to go into hypo. The vice versa. The person who needs to take say 100 units, if he is taking it with a different syringe, he is going to take 40 units. So when it's taken with a different syringe and only 40 units are injected to a person who is requiring 100 units, his sugars are going to go higher side. So to avoid this confusion, use proper syringe for the proper insulin as advised by the doctor, and never try to interchange the syringe with the insulin vials. Of course, this doesn't happen with the insulin pens and cartridges because they are fixed. And dialing the dose with the pen is much easier for them and more accurate, and we haven't seen any such problems in the patients who take insulin with the help of a insulin pen. Thank you. I hope this information was useful to you.